A lot of people signing on right now. Really appreciate everyone's interest in being a part of this. And just for everybody's information, people in all of our classrooms throughout Stone Belt are joining today. And this is the first time we've sort of live streamed it to them. So welcome everyone. Glad to have all of our participants from various lifelong learning classrooms. All right, Susan, have you started the recording? All right. Well, welcome everyone. Thank you for participating in today's meeting. It's been a while since we've done an update, but we had a lot of information to share and we wanted to get with you today to just do that. And so we've had a great deal of interest. A lot of you have registered and many have signed on. So we'll just get started. If I can get the slide to advance, there we go. So many of you may have received information or a notice online or elsewhere that I'm retiring. My last day will be next April 1st of 2022. So this is something that has been somewhat in development for a while. The board has been aware of it, but with this formal announcement, we now are moving forward with how we will hire a new CEO. And we're going to talk about that in a moment. But first, I wanted to just say a few things to everyone. And I think I'll have a lot of opportunity to say things through the year, but I had some information I wanted to share with you today. So I could say that I've kind of had an accidental career here at Stone Belt because I certainly didn't start out in 1979 realizing what I would be doing today, but I've really cherished the time I've had here. I've seen so much growth and new experiences for the individuals we support and the staff that support them. We've had new expectations of ourselves as things have changed through the years. We've just had continual evolution. It's never been boring, I can guarantee you. It's been a great experience. I'll look back on my career with great fondness for those I've worked with and for those I've worked for. I've been so impressed with what I've seen the individuals we support do in their lives and the self-determination that they have. And in the future, I'll be your biggest cheerleader for Stone Belt. I may be doing that cheerleading from a trail or on a highway somewhere out west or from my home drinking a cup of tea and watching the snow come down, but I will be in your corner always. There's no better group of people I know to help the organization move forward than our dedicated board of directors. And I'm pleased now to introduce Carol Ann Hostler, our vice president and co-chair of our succession committee, search committee, to tell you a little bit about the process they're going to follow in choosing a new CEO.
Thanks, Leslie, and thanks to you all for joining us today. We know that you all have busy lives, and we appreciate your willingness to be with us. We hope that the time that we have together this morning will be informative and helpful to you. First and foremost on the agenda, I want to acknowledge Leslie. It's a bittersweet time for Stone Belt, but the board is very happy for her and her pending retirement, which is so well deserved. For 42 years, Leslie has given so much to our Stone Belt family, our clients, our client families, our staff, our agency. She's expanded the vision that Joan Burton and Albert Johns had far beyond what they could have ever imagined. And as a result, Stone Belt ARC is a model for other agencies on local, state, and national levels. Leslie's leadership, along with her extraordinarily able leadership team, has weathered the COVID storm more successfully than we could have ever imagined. Stone Belt has much to be proud of, and the oh so capable leadership of this organization has been key. Last week, Stone Belt participated in the CARF accreditation review, and not surprisingly, the post-survey assessment feedback was very positive. This outside review of our organization, reaffirms and validates our organizational vitality, and this reality cannot be underestimated. So we do have good news. Thanks to Leslie, her leadership team, and all of the Stone Belt employees who work so diligently for us and for our clients every day, we are well positioned for a search of this nature. So I want to share, as Leslie said, some information about our succession committee and the work that we've done together in preparation for this transition. And I do want to let you know that our team, our succession committee team, has been a very cohesive group. Early last April, Board President Dan Lodge Riggle identified a succession committee to get and pulled that team together. He's been instrumental in leading, for pointing the committee in the right direction and for getting us going. Our committee members include Dan, Hal Turner, Nancy Owen, Amy Cornell, Jason McCauley, and myself. Each member of our team brings knowledge, expertise, and a keen understanding of the Stone Belt culture as articulated in the Stone Belt mission and the principles of service. Most importantly, however, each member is dedicated to our clients, our Stone Belt family, because these are the people we all work for. As I said, our committee works well together and has met regularly since May. And so I believe that we are as ready as we can be to engage in the next steps for Stone Belt. The Stone Belt board members, which I think is a total of 18 individuals. Is that right, Leslie? 18 at this point in time. Approved our committee request that we work with Brian Orander of Charitable Advisors during the search process. Charitable Advisors has worked with Stone Belt for about the past 3 years on strategic planning. And we did our homework. They come highly recommended by the ARC of Indiana, numerous other ARC agencies, and nonprofit agencies throughout Indiana. We believe that this partnership will ensure a smooth and professional search. Finally, I want to say that our committee has had several conversations about transparency with this process. We're anxious to invite input from stakeholders, all stakeholders. Opportunities for input from you and others include a town hall Zoom meeting next Thursday, October 7th at noon, or 5:30 if that's better timing for you. Or if you can't attend either of those sessions, you might want to complete and return. And I suggest, in kind of a timely fashion, that'll become more clear in a few minutes, a survey that will be sent to all Stone Belt stakeholders. So if you get that and you can't attend the Zoom meeting, please look at that survey and fill it out as soon as you can and return it. And finally, if neither one of those options work for you, you can email your input directly to Brian Orander at Charitable Advisors. And his email is on this PowerPoint slide that Leslie's got up there, brian@charitableadvisors.com. A little bit about our timeline. So as I mentioned, our committee has been meeting since May. And now as we get closer to mid-October, the search will be launched. We're going to get promotional materials and recruiting plans put in place. From mid-October to late November, that'll be a time to receive, acknowledge resumes and screen those resumes for the top candidates. And the committee at that time will also be preparing for interviews. We hope, and this is why we need your timely response on those surveys, we hope that we can initiate our first interviews with the top candidates in early December. We hope that in early January, we can have our finalist interviews, and in January as well, and this may be very pie in the sky, but we're hoping that in early January, we can forward a recommendation to the board for our next CEO vote, and the board president, Dan, will make the offer to the candidate. And we also hope that in March, prior to Leslie's full retirement, we're hoping to bring in that transition so that our new person has a chance to work with her a little bit more closely. And on April 1st, as Leslie steps into retirement, we'll be ready to move forward. I just also want to assure you, the succession committee's primary goal is to identify the person who will ensure that Stonebilt remains a strong and caring agency, a person who believes in the uniqueness, worth, and right to self-determination of every individual, and a person who will work in partnership with our community, local and state, to prepare, empower, and support people with developmental disabilities and their families to fully participate in the life of our community. So we look forward to working through this process. And please, if you want to share information, provide input, take advantage of one of these 3 options that are available to you. Thanks, Leslie.
Yeah, so I wanted to say that later today, an email will go out to our email distribution that will have the information about the town hall meetings and how to sign on to those next Thursday, how to complete a survey. And there are surveys for board members, staff members, clients and families, and other partners. There's separate surveys for those 4 groups. And then as you see, you can also email Brian. So be watching for that email later today. So I want to go through the rest of our agenda today, just so you know what we want to cover. We're going to go through our COVID status and precautions. We want to talk about some new leadership roles, share a little bit about our strategic plan, do some program updates. We want to brag a little bit about our CARF survey, and we've got some upcoming events that we want to get you excited about, and then we'll have time for question and answers at the end. So the COVID information I have is that we have had positive cases. We did not have any positive cases until about August or so of last year. So we held it off for a long time. And at this point, we have had 85 of our staff that have been had positive cases. Many of those were back in that big time, the surge back in the fall and early spring. And a few of those have been in this current surge. And then we had, and Susan told me the number, and I have promptly forgotten it, how many clients we had.
32.
We had 32 clients that over the course of the last 18 months had COVID, and no client has had COVID since we started our vaccination procedure back in, people started getting vaccinations back in the early part of the year. So, and we hope to keep it that way. We do have current restrictions in place. So we have space limitation or social distancing and mask restrictions in all of our programs. And that does restrict the number of people that we can bring in. And also the fact that there's a mask mandate. We know that some of the individuals that we serve are not going to understand the importance of that or be able to comply with that. So at this point, we're not able to open programs much more than we currently have. Another factor that we have, and it's everywhere in the in the community and in the nation is staffing issues. So Susan will talk more about those, but that's also a limiter for us. We have announced a vaccine incentive for our employees, and any employee that gets on August 23rd, we announced a $500 vaccine incentive for any employee that receives the full vaccination. And we have had response to that. We've had at least 30 additional staff that sent in proof of their vaccination when we made the announcement. As of yesterday, we had 15 staff that had received a first dose since the announcement. And then we estimate that we have about 87% of our staff that have received at least one dose. And I want to just make another plea to staff to please go out and get a vaccine. It's proven effective, it's proven safe. Information that you can get from reputable sources will confirm that. And in order for us to move forward as an organization and start to serve people that are not being served right now, in addition to those that maybe want to come to us in the future, we have to get our vaccine status as high as possible. And the program does run through October 27th. So people still have time to go out and get a vaccine and be included as part of the incentive. And I hope you will. We have established some new leadership roles, and most of this is in response to my knowing that my retirement date was on the horizon, and I wanted to create a different structure in the organization that would last into the future and put us on a good stead for that. So I created a chief operations officer and selected Vida DeWeese to head that. Vida has 30 years of experience with Stonebelt, very successful experience. She knows the programs well. She knows the individuals that we serve very well, and she knows all of the leadership staff. So she was the perfect candidate to step into that role. Before I put the chief operations officer in place, a lot of our reporting structure was kind of based on a legacy, if you will. So I still had some directors that reported to me, and while other directors reported to someone else. And so this structure is a lot more organized and simplified in terms of how the structure goes. And it's not based on historical relationships. It's more based on what's functional for the organization. And I hope that moving this direction helps position the agency for future changes and puts more leadership development in our current leaders and less reliant on my involvement at this point. So I'm going to ask Vida to talk. Once I moved Vida into the operations officer position, she went ahead and made some additional changes to the program structure, and she's going to talk about those now.
Hi, everyone. Good to be with you today. Hopefully my internet will stay stable. I keep getting messages. So as Leslie mentioned, we have realigned our leadership structure to be more functional. And in doing that, have created 3 executive level positions that oversee all of our programs. So there was not a lot of change within Milestones, but we changed the title to Executive Clinical Director, and that position now continues to supervise all the services out of our Milestones clinic. We moved Elise Anderson into an Executive Residential Director. Brian Kriebel still is the Director of Group Homes, and Nancy Smith still the Director of Supported Living in the Central Region. But this way we felt we could align the procedures and the supports we provide to all of our residential services and have them under one umbrella. And then we moved all of our day services, community employment, lifelong learning, and our manufacturing services under Tanya Vanderveer with a new initiative to create an executive, or we created an executive employment first director, and to create some new movement in those programs, which she'll talk about later. So Leslie, if you'll move to the next slide, I'll give a few of the reasonings.
And Ben, I also want to make the point that these are not brand new positions. These are realignments of people's positions within the organization. So we didn't add 3 executive level positions.
Thank you. Actually, when Tanya talks about her structure as well, you'll see that we realigned and restructured how the positions work, but definitely did not create new positions. These all came from existing resources and positions then that did not get replaced. Thank you for saying that, Leslie. So our reasoning and our purpose for the change is to align our services. We want to create more efficiencies. We want to improve quality. As Leslie has mentioned, this is preparing for future transitions and really preparing to develop the next round of leadership at Stonebelt and really mentor some new positions into leadership roles. There are lots of potential service delivery changes on the horizon. Those could happen within our residential systems, certainly within our day systems. A lot of this came from our strategic planning process and how we wanted our services to look in the future. So we felt this structure better aligns us for that. We feel we're better prepared for opportunities that may come our way based on those changes or just based on new directions that we feel would benefit our clients the most. And a very, very big goal is to promote whole agency thinking. We want to be client focused. We want better training, planning, and support. And we want our leadership working together to bring that for the entire organization of Stonebelt. So each program does have more specific goals, and they'll talk about them within their program updates. But I just wanted to give you some of the rationale behind the overarching reasons for change.
Thank you, Betta. We'll be sharing more about from each of the executive program directors about what they're doing, but it all kind of is overlaid by our strategic plan. So I wanted to share that with you now. So the board just did approve for start on July 1st, a new strategic plan. It does cover 2 years' time. Typically, we would have that time period be a 3-year plan, but with the CEO changes coming forward and with some other things that we're grappling with, we're trying to come out from COVID, and we also wanted to get it off of the same year rotation as our CARF survey. So we decided this year to go for a 2-year strategic plan. It was developed by the board and the leadership staff. We had input from clients, staff, and families. We looked at satisfaction surveys. We got a lot of personal feedback from people on what they felt was important. And there were quite a few things that I'll show you the whole strategy map, but the things that we really felt were top priorities in our next 2-year cycle is obviously employee recruitment and retention. That has been an ongoing issue and will continue so in the future. So we want to make sure we address that in the most significant way possible. We moved to an employment first position, and Tanya will share more about that in a moment. And then we're also looking at our milestones program to see what direction it's going and how it might change over time. So we're looking at having a task force for that, and Julie will share more of that. So this is our actual strategy map. And by the way, you can find our total strategic plan on our website. But this is a map we've used for a while to outline our strategic initiatives. But obviously the words in the bubbles change each time. And it's based on a balanced scorecard approach, which is often used in businesses. And you can see that we have financial resources that go into the plan. And then we also have, hopefully we generate financial resources from the services we provide so that we can stay in business. This section here, learning and growth, is all about the people that provide support, be they volunteers or staff, and what we do to make that as strong as possible. We also know that partnerships and public support are really important. So we look at our advocacy, our development, how we're positioned in the behavioral health arena, and what kind of partnerships we have. And specifically this year, we're focusing on what partnerships help us serve more children. And then how do we do things internally to make ourselves more effective? Stabilizing our workforce is our #1 strategy. Creating and implementing this employment first model is our biggest program initiative for this next 2 years. And then, of course, the leadership succession that we've been talking about with my retirement. And all of these together, what we really are in for is making sure that clients have increased quality of life, that they have more choice and control, that they maximize their personal capabilities and skills, that people have relationships and community inclusion, and that people that we support feel like they have purposeful and meaningful activities in their lives. So, as I said, recruitment and retention is a top priority, and I'm going to ask Susan Horde, our HR director, to talk about what's going on in that arena.
So we've been implementing a lot of different strategies and initiatives in order to be able to accomplish this goal. Some of the things that we did was we did pay increases for all of our frontline staff that were effective on 7/1. We also did a new starting wage structure. So all new hires come in with a new wage structure. We implemented true shift differentials to incentivize those harder to fill shifts and to reward staff who are working those weekend and overnight hours. We implemented annual increases. In the past, we had only done those for hourly staff. Now we're doing them for hourly and salaried staff. We made some significant benefit changes, reaching out to employees. You know, they needed lower deductibles and lower costs. And so we did everything we can and made some major benefit changes that went into effect July 1st as well. We do sign-on bonuses of $1,000 for new hires. We're implementing a supervisory training track where all supervisors will go through this with actually, we are utilizing a retired director to implement this program so that we have some real strong leadership in that area. We're doing an enhanced referral bonus program, which gives referrals of up to $1,500 in stages for when employees refer other staff, new hires to us. And we have a dedicated retention specialist staff in the HR department that's working directly with newer hires and trying to keep people on the right path. So those are just some of the things that we're trying to impact both recruitment and retention.
Susan, I also wanted to add that the reason we could have the increased pay for frontline staff is because of the advocacy work that's been done. And many of you have participated in that. And we were successful in the last legislative session in getting those increases. We're not done yet. So we'll continue to work on that. But we had a big score, a big win with the legislators this past session.
So from a recruitment perspective, you know, we are seeing a bit of an uptick in applicants. So these are September as of yesterday numbers. So we had 115 applicants in September. To kind of give you an idea of where they're coming from, Indeed is by far our biggest source. 78 of those 115 came through Indeed. But we have a couple other successful arenas like Facebook and the Stonebelt career site on our website that are generating applicants. Unfortunately, what we find is like other, you know, every other industry and every other employer, you know, we had 115 applications. We contacted 110 of those. And the reason why we didn't contact the other 5 is they were previous staff who were marked as non-rehirable. So we just didn't even contact them. Of those 110 we contacted, we were able to schedule interviews with 80. So that means 30 of those applicants never answered our calls after they had applied. Then once we scheduled, you know, contacted those and had the interviews scheduled, we actually conducted 57 of interviews. So that means another whole group of people went through the scheduling of the interview and then didn't show up for the interview. Of those interviews conducted, 50, which were 57, then we had 19 total hires out of that. So, you know, that's a lot of people funneling down to a much smaller number because people just ghost and disappear through the process. Actually, our applicant to hire conversion rate, which calculates out to about 16.5%, is actually much higher than the industry average, which is only 8% of all applicants turn into a new hire. So we're, you know, pushing through as many people and hoping some stick. You know, it's just that right now it's really hard to hire. I think you see it when you see the signs on all the other employers as you drive through town. So we're doing everything we can to get applicants and then get some good new hires into the system. So our turnover and retention rates, of course, through the pandemic and through all of the increased unemployment benefits and things that happened. So as of 8/31, which is the last full month that we had stats for, our overall turnover rate is 61%. Our retention rate was 68%. One of the other statistics that we monitor is our less than 3 month. They make it less than 3 months as new hires, is at 165%. And so we have a equivalent active full-time staff of 399 full-time equivalent staff. To compare that back to a year ago, our turnover rate was 55% and retention was 71. Even though it was, we thought, so horrible at 137% for our less than 3 month, it did get worse. And at that point, we had active full-time equivalent staff of 429. So some of what happens is, we have more part-time versus full-time staff. People are 32-hour a week full-time instead of 40 hours. And a lot of that can really affect our full-time equivalency, which is a good number for us to look at because that kind of tells us how many hours people have committed to. So one of the other things I will note is our unemployment rates. There were times since early summer last year that we were getting 10 to 15 new claims a week. It has slowly started to dwindle over the last few months. And this month we've only had 10 new claims so far. That's the right direction. This is the lowest monthly total of claims since the pandemic began last year. The big effect on that was that the federal additional unemployment benefits expired September 6th. So we're hopeful that that means people are going to start heading back into the workforce, and but it's another whole piece of spending way too much time on something we'd rather be spending our time hiring people rather than doing unemployment claims. So that's kind of a retention and recruitment update.
All right, Tanya, we're going to ask you to talk about this Employment First initiative that we've already introduced.
Good morning, Stone Belt. I'm so glad we have a lot of you on here to listen, especially in the classrooms. And I also know we got more than probably half of that program that's with us during the day out in the community. You probably can't have access unless they're lucky enough to be with someone who has a telephone or they have one themselves. So that's a very exciting start to our day. I know many of you have either heard, been involved with, just read about, or hearing for the first time that Stone Belt services are in a transition. And I'm going to take a two-prong approach to talk about that. One is we're coming through a pandemic. We're definitely not out of it yet. And the second part is that we are making this transition to Employment First. So bear with me, it might be a little bit. This, in terms of what is Stone Belt Employment First services, we are calling the umbrella Employment First, and this includes Bloomington, Columbus, and Bedford programs. My job right now is that I'm getting trained and learning all about our meaningful days at Stone Belt. I have many trainers. I'm working closely with this org chart that Leslie's going to bring up, and I'll talk about that by service. And so the first one is our manufacturing services, which is Casey Jetter and Billy Brim. And that's our Bloomington and Bedford. And a part of the transition is that our manufacturing services are preparing for the elimination or the possible elimination of 14C That is the law that allows us to pay piece rate. We're also focusing on bringing in value-added work that will help increase client wages. We're also focusing on production, exploring integrated work, and helping figure out how to keep our demands for Cook going in all of this transition. Our manufacturing services will also be used as a work experience for those interested in exploring manufacturing jobs. How are we doing right now? Basically, Bloomington Manufacturing, shout out to you guys. I know you're on this morning. You're on track for 5,475,760 pieces, which is only about 200,000 off from last year. So that's really, really good in a pandemic year. We're also looking forward to some work, new work with Cook, and Casey is actually working on that as we speak. Another shout out to Lark Manufacturing. You're on track for 148,606 pieces, and that goes with our community partners of Catalent, Canadian Roto Hinges, Oliver Winery, the Deer Cage Company, but I especially want to mention the 2,000 belts you all worked on for our US military. So we're very proud of that. This brings us to our community employment program. Mary Ellen Jones is in charge of all 3 counties for that. And we'll continue to provide services through finding and supporting clients' jobs, of course, project search and internship programs, our pre-employment transition services with the local schools for our youth ages 14 to 22. Our goal is to add at least 10 new community employment clients that come from our lifelong learning and manufacturing services in the next year. I want to give a shout out to all of you employment staff on the employment team, because I want to thank you for making 37 placements in this past year, which also was a pandemic year. And that's the best we've done since 2015. So congratulations. Also want to say many thanks to those who are driving from one county to another to help out during these staffing shortages. I want to give you all just a few numbers to think about. If I were a little more techno savvy, which I'm getting there, I would have these on a screen like Susan. But you can also hear these out and think about them. So our active clients with VR for all counties is currently 89. And in February of 2020, it was 57. So I think we're doing really well in employment, pushing through this pandemic. We also know that employers need employees. It is our very best time to go out. So Susan Hord's department could get us lots of employees. I bet you we could place all of those 10 that's on our goals, as well as 10 or 20 more. Our follow along in February of 2020, which is where we're helping folks in jobs for a minimal amount of time, went from 67 in February of 2020 to 60 right now. We believe the furloughs and things like that where people have not returned to their jobs is affecting that somewhat. Our pre-eds program, which is our school age program, in February 2020, we had 62. We now have 74. So congratulations, employment. I think you're doing really well. We also have some highlights. We have gotten back into the B&L schools. We've got a great relationship there. And I learned this morning that we even have a classroom that we are beginning to use. As well as yesterday, Mitchell opened back up for our pre-ed students to get in there. So that those are real breakthroughs during the pandemic. Also want to give a shout out. We've got some action going on with McDonald's, Rural King, our janitorial services in the schools, and Wendy's in Lawrence County. In Bloomington, we've got lots of action with KeHE, our community partner KeHE, Kroger, Tobias, That's the cafeteria for the athletes at IU and Cardinal Spirits. We also got a shout out with working hard in Brown County to work on our pre-ets with the bistro at the Ferguson House. And that's to allow students to go in. And we're also trying to build community partners with that. I just want to say again, congratulations to our whole community employment team, pre-ets. And then I want to move on to talk just a moment. Mary Ellen is also in charge of Families First. And that is the group of families who actually serve their loved ones in their home. That has grown as well from 14 to 21. So that's pretty awesome in the pandemic. I want to speak also about our lifelong learning transition program, because those become geared towards teaching pre-employment skills, the focus on the soft skills needed for employment. These would include advocacy, communication, social interactions, workplace readiness, and more. These skills will benefit clients in whatever path they choose. And just because we say employment first never means someone has to go get a job. It's all about choice. We will use a combination of curriculum, and we have teams that are working very hard on developing curriculum across the organization so that this can become simpler for all of our DSPs who are trying to implement it. Hands-on learning, work experiences both in our facility and in the community. We'll teach and train and support staff to understand that any activity they do is a part of work readiness focus. Our lifelong learning, I was surprised to hear this morning. It just keeps growing. We're very, very happy about that. In February of 20, we had 226 clients on our roster for Empower. That's the records keeping system that we have. And I had to go to each area and talk with folks because some of the clients were not serving, but they haven't necessarily been closed out. And so our records wouldn't have been accurate, but I want to say, congratulations, it's 181 out of those 226. So that's really good. Just a shout out to all of that lifelong learning team and some of the highlights of things that they are doing. We've got a group going back to the Humane Society in Columbus. We also just went gym mining in Brown County for the gyms where you shake and get your stones. We've also visited the Indiana State Police Museum. Got at Bedford, we've got the great outdoor space, and I want to really give a shout out to that LARC team and the LARC board, because the outdoor space and the inside beautification projects are awesome. So we're taking great advantage of our great outdoors down there. And the Bloomington LL team is moving back into the community full force with gardening, community kitchen, the hand-in-hand route, adaptive weightlifting at the YMCA, young adult gaming. We've got 8 groups going into the community, and they are figuring out every day how to use the staff that we have to do all the things that we need. So I'm very proud to say I'm a part of this big plan, very excited. We're looking for new ways and new suggestions about how to involve community members. The last thing I'll say, I know we're thinking about Veterans Day, and so we're recruiting 5 veterans to come in, and we're going to make very special gifts for those servicemen. And that's just one example of the many brainstorm activities that we're trying to do. Tomorrow will be our second coffee with the boss, thanks to our whole employment team that sets up to bring someone very important in our community. And we're actually using all of our technology that we're using today to allow everyone to participate. That program is just going to grow and grow with our availability to do that. So that's our Employment First model, and I'm very happy to be representing it. Thank you.
Great, Tanya. How exciting, all those changes and all those things that you're putting in place and coming back to life, but after COVID. That's wonderful. Julie Miller is going to tell us a little bit about what's going on at Milestones.
Yeah, I don't know. That's going to be a tough act to follow. It sounds like there's a lot of exciting stuff going on in the Employment First program, but things are going well here at Milestones. As Leslie said earlier, we're happy to get through the CARF accreditation, and very happy to say that all of our Milestones programs went through that. We had a couple that were newer programs to Milestones that, you know, had not been able to go through in the past. So we're looking forward to getting those official results. The other thing that's already been mentioned is the task force. So now that we're through CARF, kind of looking at Milestones and reassessing, okay, are we meeting the needs of the community at this point, and seeing, you know, what we can do to improve that. So as far as the clinic goes, our psychiatry and outpatient therapy, we are continuing our anxiety clinic. That's the one component of Milestones that's been unique over the past few years, and as you can imagine, very important during the times of COVID, and, you know, not just within Stonebelt, but a lot of people dealing with the anxieties of what's next, as this is not something any of us have dealt with in our lifetime. So that program is going strong. And again, our outpatient therapy and psychiatry programs continue. We're looking at adding some interns this spring, and so that's a really exciting thing. That we will have probably an intern with Beth Murray, who's one of our advanced practice nurses, and then looking at how we can bring interns into other programs, basically spread the word about what we're doing here at Milestones, use that as an opportunity to maybe get some more groups going now that it's safer to do that, or, you know, as we hope will be in January, not immediately. But so those are some of the places that we're looking to grow the clinic in the spring. And again, that continued assessment, and that kind of falls right into our behavior supports program. We have a lot of clinicians who share their time between behavior supports and the clinic, and that honestly allows them to maximize their time and get some very solid experience in a variety of programs. And it's been really nice to have that flexibility. Our behavior supports continues to be, in my opinion, and actually feedback we receive, one of the strongest in the community. So very proud of that program and all the work that they're doing. The other program that you've probably heard a lot about lately is our rec therapy. And it started just about a year before the pandemic, but really was kind of starting to grow at that time, but has continued to grow. As a component of that, Kim Shepard, who is she was our first rec therapist, has been promoted to a coordinator position, and she's got so much energy and enthusiasm, and we're really seeing a lot of progress with those clients and being able to take that unique approach. I think some people have different opinions of rec therapy and feel like, oh, they're just out playing, but that's not even remotely the case. They are using all of these activities to really build clients' social skills, coping skills, all of these things. And it's just wonderful to hear the feedback from clients and from family members and how successful that program has been. So we absolutely plan to continue growth there. We've got positions open. We've got a lot of positions open at Milestones. So if you know anybody interested, I'm happy to talk to them. Mary Shawcroft was supervising rec therapy. We've shifted her over a little bit. I'm now supervising rec therapy, and Mary's new task is going to be to work to grow the music therapy program, and that one's even newer to us. So right now we only have one music therapist, but that's a program that I think, as we continue to get the word out, and people have a strong interest there too. And I think we see some of these, what might be deemed alternative therapies, can be very effective with a lot of the clients we serve. And it's an exciting possibility for us. As all of you have seen, our nurses continue to be busy. A lot of COVID testing, which I know is not the favorite part of their job, because like all of us, they'd rather be able to move beyond that. But we've been doing a lot of that. We are also getting into next week being able to start flu shots. So they've been successful in obtaining the flu shots. And so we'll be doing that for staff and employees, and working hard to keep everybody healthy this fall. And they're doing all that in addition to seeing all the clients still. So I just have to brag that we have a great group of nurses that are able to do that. And then I will wrap up finally with our skills development program. So our skills program, as most of you know, is a little bit unique in that we work in conjunction with Centerstone. So we continue to grow the skills program as well. We've had a really good working relationship with Centerstone, and that's just beneficial to all of our programs, that we can work closely with our local community mental health center. And so with Centerstone, we'll continue to grow that and continue to grow those relationships. So like I said, overall positive work going on here, and just very proud of the team we have. So.
All right, thank you, Julie. Elise Anderson is going to give us some information about the residential programs.
So I think our number one concern in our residential programs, both our group homes and supported living, is obviously our staffing crisis in both group homes and supported living. A few weeks ago, I gave a presentation to the board, and I think at that time I reported to them that we had 56% of the staff that we needed to be fully functional, be able to provide the quality at the level that we wanted to provide it, and do all the things that we want to do for clients and staff alike. So I'm excited to see the efforts that HR is putting forth to help us with all of those open positions, and hopefully making some headway now that the changes in unemployment have happened, and we can get past that. So we're working diligently with HR to let them know what our needs are and what our priorities are, so that they can assist and support us in that. We're working on, I'm excited to say that all supervisors in this agency, not just in residential programs, but we got some reports from Susan Russ that every supervisor that we identified that needed to go through the supervisory training that she's providing to us, with the exception of one supervisor, has had their first meeting. And that's an incredible feat for our programs. You will often hear people say that if people leave jobs, they're not really leaving their job, they're leaving their supervisor. So providing all of our residential supervisors and all the supervisors within the agency with the tools that they need to be the best supervisors that they can be will help us to move those retention numbers in the direction that they need to move, and help us to be able to move that needle of quality back more toward the center where we want it to be. It will help alleviate stress on staff and clients alike. So we're looking at bringing back quality teaching and training to show staff what services were like pre-pandemic, because I think if we all take an account of what's happened, there's just been a general erosion of systems and quality within our programs that none of us are happy with, but it's just a result of the pandemic, and we hope to be able to move that needle through some changes in our training. And I want to say that I am extremely impressed with the resiliency of the people working in the residential programs, from the DSPs to home managers, site supervisors, house managers, associate managers, CUES coordinators, associate directors, and on up. Everybody is working really hard to keep clients safe and healthy and happy. And all of those people are the heart and soul of our programs, and the face of Stonebelt. And so I'm extremely appreciative and proud of all of you. I'm going to talk about specific programs a little bit. In group homes, we currently only have one opening in Bedford. We're able to fill our other opening during the pandemic, which was a feat in and of itself, I think. I am kind of like Tanya says, she has a lot of people training her. I'm learning the hustle and heart of group homes. I have about 5 years of experience in the ICF arena, but it's been a long time ago. So I'm refamiliarizing myself with that, and I have a lot of people helping me in that way. And I'm appreciative of all of that help. Moving on to SLP in Bloomington, we've had lots of roommate changes in Bloomington and moves in the past couple of months, and those were done to honor client choice, client request, and then to also provide more effective services. I think over the past few years, Nancy and Tammy, and with BITA support in SLP in Bloomington have done a lot of things to try to use our staff as efficiently as we can in different areas. And Nancy, Tammy, and I are going to continue to do that. We are meeting to discuss how we might better use remote supports within the Bloomington SLP program, or other kind of supports that might help us be more efficient in any way that we possibly can, while still providing quality supports to clients in the areas that they need. We're also working with several developers within SLP in Bloomington to create some housing options, some additional housing options for clients. There's the Switchyard apartment complex, and then there's a complex out in Ellettsville, which each will have designated a certain number of their units for people who have disabilities, and they are reaching out to us to help to, I guess, fill those apartments when they come open, which only creates more options for clients. And of course, that will be client choice. You know, the options can be presented to people, and if they choose to take them, that will be great. And if they don't, that's okay too. SLP in Columbus and Bedford. Within the structure, within the new structure, I remain the director for SLP in Columbus and Bedford, but we have promoted an associate director. That's Ron De La Cruz, who has about 12 years of experience with Stone Belt. He worked in the group home system as a DSP and as a home manager, and then moved into supported living as a coordinator, and then was with this new structure promoted to an associate director, and he's doing a great job supporting those programs. Columbus and Bedford are maintaining client supports and finding more ways to get back to typical activities. We have had one recent discharge in Columbus and Bedford, and we are currently evaluating referrals that we receive to see if they're appropriate, and if we even have the capacity with our current staffing crisis to add anybody within that system. We do have capacity in Bedford to add a client. That person might be somebody from our group home system who might be ready or wanting to move into waiver services, or maybe it would be somebody from outside of the agency, but we have that capacity there to add somebody. And then our goals within the new structure for the next year or so, we're hoping to break down some silos across programs to create some efficiencies, to create better systems for teaching and training and supporting for both our staff and clients, and especially for our supervisors, so that we are able to set every DSP off on the right foot with a good, solid supervisor supporting them. We expect to improve quality of life for clients and move back into more community-based settings. I expect to see some bring back some systems that have eroded away that are important. And I'll be looking to all of those teams within supported living and group homes to help figure out what that looks like and how we move forward. So I want to end with a couple of pretty cool client stories. I'm going to start with a group home story about a fellow who has whose family placed him in a group home when he was rather young, and he had 5 siblings, and he was one of 5, and his family was worried about how he would be affected if they continued to have contact with him. And so he didn't have contact with family for years, except that there was a brother who knew that he came to Stone Belt, and he was somebody who filled our vending machines. I didn't know the story until Cindy sent it to me last night. It's really cool. He knew that his brother was here at Stone Belt, so when he would fill the vending machines, he would stop and talk to him, not telling him that that was his brother, so that he could kind of check on him and see that he was okay. And then he also would make sure that back when we had the leather program and this client would make leather products, he would go buy his brother's leather products as a way of support. Such a cool story. So recently, one of his brothers reconnected with him. So it had been years and years and years since he had seen family. And so that person lives on the north side of Indy, and they don't get to see each other a whole lot, but they have reconnected, and we're hoping that there are reconnections with the rest of the family and not just the one brother. So that's probably the coolest story I've heard lately, but there's some other cool ones as well. We have a client, Amanda Wilson, in supported living in Bloomington, who will be going to nationals in Orlando, Florida for bocce ball with Special Olympics. And she most recently participated in a really cool fundraising program where they did a playing pool. And what that means is they play tug of war with a Boeing FedEx 757 jet airliner to raise funds for their trip. So if any of you are interested in supporting that effort, they have a Facebook page. I believe it's probably Special Olympics in Monroe County. So if you're interested in supporting them or supporting Amanda, go figure out how to do that. She would appreciate that support. And then I want to highlight another client who is in our Bedford program. And I would have described this person at years ago, this woman years ago, as a little bit oppressed, didn't really have her own voice. She would look to others to speak for her. I met with her last week with the CARF surveyor, and I saw just a completely different person. She speaks for herself. She was comfortable speaking for herself. She didn't look to other people to gauge whether it was okay, what she was saying was okay, or whether it was even okay for her to speak. She is in a committed long-term marriage, and she has also gained her voice in that way to be more vocal about what she wants and needs. And I was just super impressed. And I think that is a significant effort of several programs within Stonebelt and Milestones who have helped that client to find her voice. And then lastly, I'm going to talk about a client in Columbus who came to Stonebelt within our group home system. And he moved from group homes. He wanted to be closer to his family, and his job had gone away. So he decided it was a good opportunity for him to move into supported living. And so he did that, and he lived for a few years with some housemates, and he was not happy in that situation. And so his team helped him to get his own apartment. He is now living in his own apartment and has been for at least for a year, maybe a little bit longer. He has been extremely successful in doing that. He has integrated himself into his new community. He is well known among the disability community. He is a participant in self-advocates. He is involved on the Arctic Bartholomew County Board and the Indiana APSI Board. He has been a past member of our Human Rights Committee, and he has just flourished. And it's just a great example of how we can honor client choice for somebody, even sometimes when we wonder if it's going to be successful or the right thing for somebody, and then it turns out to be. And lastly, I'm going to segue into, I think the next segment is CARF, but I want to say congratulations to everybody at Stonebelt. I don't know if each and every one of our staff understand their role in our CARF accreditation, but everybody has a role. If you are implementing a policy or a procedure, you're helping us be compliant with CARF standards. If you are helping clients to have choice and control in their lives, then you are implementing CARF standards. And I was very impressed with the things that I saw when I went with CARF surveyors out to our residential programs, and super impressed and kind of brought to tears a little bit listening to the good things that they had to say about our programs. So thank all of you who influence those opinions of those people who work all over the United States, and some of them have reviewed programs nationally. So congratulations, and thank all of you for your hard work.
All right, we will move into our CARF overview, and Betta's going to be leading that
Well,
presentation.
Denise, you couldn't have gave me a better segue, because I want to open with just a huge kudos to all of our staff and clients as they participated in CARF. Specifically want to shout out initially to our directors and associate directors. As you've just heard from many of our leaders, many of them have moved into new roles where they were willing to take on more responsibility and additional programs. They're getting up to speed in those. And they had to then go through a CARF survey, either it being their first one in their role, or with a new role and new programs that they had to learn very quickly. They did an excellent job. And I also want to do a huge shout out to our coordinators, supervisors, and direct care staff, because they really supported clients and showed CARF what an incredible agency we are, and that they are the heart and soul. So let me first do a real quick CARF, in case people don't understand what it is the Commission on Accreditation of Rehab Facilities. It's an independent nonprofit accreditor for health and human services. We are required to go through some type of accreditation. We choose CARF. So we had 4 surveyors here for 3 days looking at every program and administrative service we have in every location. So they had to be driven to every county, to every program. I've been through many CARF surveys in my 31 years with Stone Belt, and this was definitely the most thorough survey we've ever had. We got 4 surveyors who really took a deep dive into everything we do. And they're all specialists in their area. And for them, it was their first in-person survey since the pandemic began. So I want to say that there were 2,092 standards that were looked at. Of those, we received 18 recommendations. And those are places that then we need to formally write or acknowledge how we will correct those. But that also means there were 2,074 standards that we were clearly meeting with no recommendations. Most of the recommendations we got are easily fixed. Some have already been fixed. They're in a variety of areas, mostly administrative, where we're mostly doing the right things. We need to do a better job of documenting them or putting them into a procedure. We also received some suggestions, which are things we can review and decide if we want to implement them. CARF surveyors are experts, so they do give us suggestions that may very well be worth our while. But at the end, and where I want to focus most of my points, they talked about our many strengths. They talked about what a really great organization we are. You can go ahead and move forward, Leslie. They talked about our innovative, engaged, dedicated, and professional staff who have fun. And they talked about the dignity and respect we show clients. That was fantastic. They were impressed by our person-centeredness, our all-inclusive approach, and one of my favorite lines, how we support clients' body, mind, and spirit. So specifically, administratively, they made note of our noteworthy strategic plan, our excellent development efforts in the data management system that we use, our dedicated board of directors and our very diverse board of directors with their incredible backgrounds, our enviable data management system, Empower, which every one of them commented that they wished they had, our solid financial health and our strong chief financial officer, our strong technology, and our good health and safety practices. Programmatically, they commented on our excellent quality of life survey, which is also a focus for us in the next couple of years to really implement how effectively we use that. They talked about our strong work culture and our quality work and contracts and our manufacturing services. They talked about our very creative transition services that has won awards and done state presentations. They commented on our student self-advocates group, which I think many of you know is the first student self-advocate group in the state of Indiana, may still be the only one. They commented on our excellent employment services. They talked about the many employers that they spoke with and who said great things about our programs. They visited several job sites that were very impressive. I know they went to KeyHe, which Tanya mentioned, has been hiring a lot of people. They talked about our Boost program being exceptional for training DSPs. They talked about our lifelong learning programs and residential programs where staff, family, and clients say great things about our deep commitment, our responsiveness, and how we truly live our mission statement. They said that it was evident in everything they saw. They talked about our supported living and group home services and programs, that provide individualized programs and supports and focused on community participation. And within milestones, as Julie mentioned earlier, which included behavior management, rec and music therapy being surveyed for the first times, they commented on how those programs, as well as our nursing, all of our clinical services, and I'm sure they would have said our skills development services as well, they just weren't being surveyed since their partnership with Centerstone, truly add quality of life for clients and truly add support to the way they are able to live their lives. So now we wait. With all of that, it will take 6 to 8 weeks to get the official report. The potential outcomes do include a conditional accreditation, a 1-year accreditation, or a 3-year accreditation. We have always received the best, a 3-year accreditation, and we don't expect any less this time, because as you can see, they thought we were excellent. They were so complimentary, and I can't thank all of you enough for that. I think we were all a little bit more nervous about CARF this year, being a pandemic and all, being in person, knowing that we're still not out of this pandemic and trying to show our best when we're still climbing to get back to our best. But we had no reason to be nervous. All of your great work showed so clearly. Stonebelt did fantastic because our staff and clients are a part of an excellent organization, and that came through loud and clear. So thank you, thank you, thank you. We'll update you when we get the official report.
Thank you, Betta. Just going to conclude our presentation, talking about some events we have coming up. The one that will come up the quickest is our annual celebration. And once again, we're going to have that at the Starlight Drive-In. That's going to be on October 13th, which is a Wednesday. And it will start at 6:30. And you can go on our website, or you can go on our Facebook page and find information about how to sign up for that. We'd love to have you. It's open to everyone. We are going to have our IMU performance. This is something we've done every other year for now, I think 9 seasons. So on February 25th and 26th, we have that. We have 10 performers that are working on their performance for that. And we also are bringing back some of our performances from recent years. So you can see these are a reprise of some people's presentations. That's at the Ted Jones Theater, which is located within the Bloomington Playwrights Project on 9th Street here in Bloomington. And then we're going to go back to our Belt Out Loud concert. We had one in 2019, and it just wasn't to be in 2020 or 2021. But the Buskirk Chumley Theater will be alive and ablaze with Stonebelt fun on that night. And we have engaged a great performance artist, Jen Christie. She's well known in this area as kind of a rock soul singer. It'll be a blast. So I hope that you all will be able to come to that. Now we do have, we had left opportunity for you to ask any questions. I see some things in the chat. Susan, are any of those questions? And if you have questions, you could pose those now.
Leslie, we
Any of them need to be addressed.
their hand up. Sorry, Susan.
That's right.
Lisa Chaplin has her hand raised, if that's indicating a question, Lisa.
Yeah, you could put your questions in the question and answer area, and we can respond to those. Or anything that's in chat that is a question.
I want to make one more good comment about CARF while we're waiting to see if there are any questions. I think historically we have wondered how deep CARF has really looked at our programs. And I feel like this year we talked about how every surveyor really took a deep look. So with all of the positive comments that they gave, with the deep look that they actually took, I think that just, for me, is a little bit of icing on the cake, that it's real and not just, I guess, lip service.
So thank you, Elise. Robin asked about when tickets will be available for the concert. I anticipate that will be somewhere maybe in the February timeframe. Maybe by the time we have IMU, we can have tickets available for you to come to our next event. So be watching, watch our Facebook page for information about that. We'll also send out emails and such as well. When will we have dance party again? Tanya, you want to respond to that?
I'd love to respond to dance party and any other things that we can do that we have to be closer together. I look to all the supervisors and all the coordinators in lifelong learning to help us answer those questions, because basically our guidelines are that if we've been vaccinated and we're wearing a mask, we can be in closer proximity. If we're gonna eat, we have to spread out 6 feet, which is one of the things that's affecting how many people we bring in here during breaks, lunchtime. So coordinators and supervisors, I would really like for you to work with clients and their requests for us to be able to get back on track with not only that, but everything else that would require those kinds of decisions. I look forward to dance party too. Thank you.
And thank you, Charlotte, for your positive comment. It's an honor to have you on with us today. I appreciate that you've been a part of our presentation. Thank you so much. All right, and Susan, we're glad to have you as well, Susan Klein. It's nice to have supporters that are out there. I know clients and staff and families are very engaged. It's nice that people beyond that sphere are also a part of our support. So I think with that, we'll close up for today. And we appreciate you all being here. We had a great response. I saw up to 72 people and on the program at one time. And I know some of those are groups of people that are on. So I hope this has been informative for you. And I do appreciate that you've been with us today.
Thanks, everyone.
So we'll close out now. Thank you so much.